Okay, thank you very much indeed for joining us. And today we have a webinar with a difference. This is being held in collaboration with the National Association for Healthcare Security. Now it's in the afternoon here in England, and they've had a conference all morning, but they're joining us this afternoon for a debate and a discussion about this topic of healthcare security. So what's going to happen is I'm unusually, because they've got a conference, just going to spend about 15 minutes giving you a bit of feedback from some of the issues that have been emerging in the last few months when we've been doing these webinars. It's the 71st webinar today, 71st. I'll give you a few insights of what's been going on, and then I'm going to be joined by an elite panel, and at that point it'll be a great chance to debate what's going on in security, international as well as UK. All of them experts, all of them involved in healthcare security in different ways. And we're going to be asking you, the audience, to get involved with your views and your points. So they've asked me just to spend about 15 minutes giving a little background to what's been going on with these webinars. What have we been learning from what's been done so far? And the first 70. And before I set a context for that, I want to let you into a little secret. And that is that very recently, I've been doing an extensive amount of shoplifting. I've been out with ex-offenders, and we've been going to shops, stealing from them, as any shoplifter would. And let me quickly redeem my reputation by saying that we give the goods back, and we're getting paid to do it. The idea of this is what retailers are doing is they're sending us in to test out their security. And so we behave like criminals do, like exactly like an offender would, except if we get caught, we've got quite literally a get out of jail card free. And we are caught occasionally. But what this does is an absolutely fascinating insight into security at work. One of the things you get by behaving like an offender is that you get to see security from the offender's perspective. And this can be very, very informing and very, very confronting in a way. Because when you go to any store, in almost every country in the world, I suggest, any big store at least, all the major chains, they've all got security of some kind. Security officers, cameras, alarms of different descriptions, exit gates, tags, which are types of alarms, of course. And they're all designed in different ways to make theft less likely, or to make it very, very difficult, of course. And when you're an offender, you get to test out how good it is. And you know, one of the most striking things of all is that when you behave like an offender, is you begin to really recognize how important people are. Now, let me put this in perspective for a second. Security has a role to play, no doubt about it, of all sorts. Technologies have a role to play, all sorts. Some people say in the academic world, the problem with crime prevention measures is they just don't work. And they point to the levels of crime to say that it doesn't work. But I would actually say the complete opposite, that I would say all measures, or nearly all measures, work some of the time against some type of offenders. And it all depends on whether you've got the right measure in the right context that's working effectively. And these things are very easy to say and very difficult to do. I remember a few years ago, I was doing a study actually about CCTV. And my object was to understand, I thought, wouldn't it be a good idea to find out what the most serious offenders of all think? Murderers. I mean, would people commit a murder on CCTV on purpose? So I managed to get a focus group discussion in a prison wing, maximum security prison, of course, murderers, 10 murderers and me in a room, I mean, it's a big cell really, discussing the topic of CCTV. And it was an absolutely fascinating insight, I've got to tell you, fascinating. And they were really quite informative, really engaged. And one of the points that one of the offenders made about CCTV, I said, look, does it really, really concern you? And by the way, their general view that CCTV didn't bother them too much, principally because at the time they committed the murder, they had lost control, they'd lost rationality, and so they weren't thinking about the consequences. Often drugs, sometimes drink, and sometimes anger. In a couple of cases, it was over a relationship. So CCTV itself didn't seem to worry them too much. But one of the things that one of the offenders said to me that day has always had a thought in my mind. It said, I don't really care about cameras. They can't jump off a wall and arrest you, can they? And therein was the point. And it's the same point that I found when I was going out with shoplifting recently. I've done it the last 3 weeks, actually, so I've been doing it quite a bit. But one of the things that you most fear is a person intervening. Now, of course, good technology can provide the evidence and information and make that all the more likely. But when you're walking around, you know where the cameras are and you know where the alarms are, but you don't know where the people are. I sometimes, I often say this at talks, but I like to say it. Sometimes when I'm giving talks, I'm doing interviews, and particularly radio interviews. One of the things they'll say to me is, Martin, if you could do one thing, just one thing to prevent crime, what would you do? And of course, the honest answer is I don't know. But what I think I would like to say, if I could, and I'm going to repeat this point, I don't know whether this is brilliant or ridiculous. Before I say it, I'm going to confess. It might be brilliant, it might be ridiculous. But if I could say one thing that I think would make offenders most likely stop committing their crime, would be if at the point they were about to commit it, they believed they would get caught. The question is, how can you make offenders believe they will get caught? So when I'm shoplifting, one of the things that's the most daunting of all is some very inconsiderate cashier or shop assistant asking me if they can help me. Now, this is great customer service, of course, but when I'm in my be a thief guise, then I don't know whether they are saying, can I help you, to be friendly because they think I'm a customer, or because they spotted me trying to steal from them. And of course, it's off-putting. I have to get away from them and move to another part of the store at the very least, or I might get out altogether. And therein lies the point, that how can we make offenders believe they're going to get caught? And what this whole period of these 70 webinars we've done so far, 71st today, as I was saying, is give me a lot more insight into the challenges that lay ahead. I just thought I would say a few of the themes that are coming through that I expect may come up in a different guise today, in the sense that today specifically, we're talking about healthcare. And one of the first things to come through the webinars is the need to change the perception of the security world. And there are those, and I expect this will come up today, who have argued that during this crisis, security has performed extremely well. Some have argued that so well, in fact, that it's now got a seat at the high table. It's now got respect and prestige in the eyes of various stakeholders in organisations and amongst the community, that will, as a consequence, see it much better place when we get over the virus, and pleased that we do get over the virus. And there are those who have argued the complete opposite. And it goes something like this, that some have performed well in the crisis. The truth of the matter is the fact the security world and business was so unprepared, but the security aspect, after all, was supposed to be onto this, was so unprepared, suggests that security wasn't well placed and wasn't in a good position. And the suggestion that it's got prestige and credibility is misplaced. And anyway, even if it did, in a crisis, security is supposed to perform well. That's its purpose. Just wait until the subsequent economic doom hits us. That's the time when security will be cut back. So don't get too excited too soon that you've done well, security world, because you're about to find out how fragile it all is. Well, I'm hoping that we might have that debate today in the context of the health service. And the issue of reputation is a big one, because on various webinars, we've spoken about how we can change the perception of the security world. Most recently, we had an interesting debate on names, two on names. One webinar focused on whether we should use guard or security officer. And although there's a lot of call for using security officer because guard is a pejorative term, On the other hand, there are various parts of the world where the word guard is entrenched, and where some argue there's no misunderstanding about what it is. And the fact that in other parts of the world, and Canada is a case in point, or some parts of Canada, you can't use security officer because it's banned by law. There are other uses for that terminology. So you can argue if you want we should use security officer, but it's difficult to say you can do it internationally. Others have argued what we really need to do is understand the word guard and put credibility behind that word. The debate continues. We had another webinar focused specifically on job roles and the importance of job titles and what they really mean. And an interesting debate there, which raised a suggestion we should forget the word security altogether. Some have argued resilience. In that webinar, the word risk was seen as a better descriptor, a more credible descriptor. Risk is central to business in a way security isn't, some people argued. We'll see. Another issue that's cropped up is the need for security to show that it adds value. Now, value. And a real point that's come through here is that some have argued that during this crisis, security has shown its add value by the central role it's played. For example, and I'm sure Barry Millett, who we'll speak to in a minute, it can talk about this, its role at testing centres where people need to be socially distanced, and dealing with staff who are upset and patients who are upset, protecting each from themselves and from others. The role it's played has been central, and that perception is a positive one. But the perception also comes from a survey that was done recently in the United Kingdom, which didn't rate the role of security officers very highly at all, just above traffic wardens, in fact. This idea that the security world says to itself it's good is not always the case how stakeholders see it. And we've got to make that distinction between the two, about what the security world says about itself and what its stakeholders are saying about it. I think another interesting point that's come through all this is the need for security to be at the heart of business. And we had a webinar specifically on this topic. And one of the panelists that day said, well, if security is done well, of course it's at the heart of business because every single person is involved. And indeed, this is a truism, isn't it? That every single individual and every single process is in its own way a contribution to good security and a potential weakness. And so the argument goes, and I've argued this many times at speeches I've given around the world, that the real issue here is making sure that we understand the reality for what it is, that it's all very well to say security is at the heart of business, but are the people who are running it business-like? Again, we had a really diverse set of opinions on a number of webinars where those who were saying the modern security department, the modern security supplier is very business focused. These are business individuals who've got a good business sense, who understand every process and every person's role because everyone is a potential weakness for bad security and a potential ally in good security. Well, the debate goes on about the merits and the extent to which security is business-like. Let me come at this from another angle, if I might. We have had another webinar about the attractiveness of security as a career. Myself and colleagues have recently published a report, particularly Charlotte Howe, who works with me, on careers in security, with a survey of people in the security sector about what attracts them to the security sector. And you know, one of the most interesting things of all, what attracts people to the security sector? They find it by chance. And many people out there will have an understanding of that, purely by chance. They get into security by chance. Yet most of those who find it by chance then find it very attractive. And you know some of the really interesting points about security, why they valued security? Because it is a way of serving the public. In other words, just like the public sector security, police, etc., said is the value in what they do, so private security do. Private security in corporations, in security companies, also say they like the idea to serve to play a functional role. One of the other points I'd like to make is that some of them said they like security because it's lucrative, because there's a chance there to do things that are varied. There's lots of different career possibilities, but it's lucrative. And of course, the security world is known for being just the opposite. And we must remember to make a distinction between the quite ludicrous pay scales that exist on the front line, many of which we've heard about, on these webinars. But beyond that, the fact that we mustn't cast this world as one where it hasn't got lots of opportunities and it isn't lucrative. It is. Let me finish though by a point I want to sum this all up together. And I want to tell you a story back to prisons from a prison cell. A conversation I had as I was walking out of a prison. I'd been interviewing fraudsters and I was about to leave. And as I was about to leave, this guy came up to me and said to me, excuse me, Martin, I'm in prison and I would like to ask you if you do me a favour. Would you be prepared to tell your audience when you give talks this story? Now, when you're told to do that in prison, you've always got to be careful. I said, well, I'll tell you what I'll do. You tell me the story. And if I think it's reasonable, I will feed it back to the audience. And this was his story, from the prison cell to the people of the to people of the world. And this was his story. He said, I know you've been interviewing fraudsters, but unfortunately, I couldn't speak to you today, principally because I'm in here for fraud, but I'm denying it. And I said, well, if you're denying it, then obviously there's no point in speaking to me about your offence because I need to speak to offenders. He said, but I want to tell you something. He said, I want to tell you something. When I was on the outside, I, believe it or not, was in charge of the organisation's response to fraud. He said, incredible. I'm in it for fraud. And when I was on the outside, that was my role. And he said, do you know something really, really interesting? He said, one of the real difficulties I had was getting the company interested. One part of the organisation wouldn't share information with another part of the organisation. When we did spot someone, there was a reluctance to take action. When we asked the senior managers about support to take action against people we thought to be pretty bad, they were very reluctant. But the most they would let us do is let them lose their jobs, the most, and even that was difficult. As for reporting it to the police, that was a real problem. They weren't even prepared to do that. And even if we did report it to the police, we couldn't get any action. It was absolutely dire. I said, well, to tell you the truth, of course, I've heard that sort of story many times. He goes, but that's not the point. That's not what I want you to tell the audiences around the world when you give your talks. I want you to tell this. And this is what he said. So a message from the prison cell to you. He said, and then I came to prison. He said, and in prison, we all share information. In here, everyone's sharing information about who the easy targets are, how they got caught, and how they would avoid it next time. What are the best ways of committing offences and getting away with them? All sorts of offences, not just the ones we're in for. And he said, this is the point, Martin. Don't you think it's ridiculous that on the one hand, the outside world is not collaborating effectively, and on the inside world, in prisons, they're doing it so effectively, the odds are turned into their favour. And therein, we have a problem. That's the world that we face. Now, many of these issues are going to crop up in a different context, I think, today, but they highlight the needs and the difficulties in doing security well. And the very specific context we're going to talk about today is healthcare. The good thing is I've got another elite panel. Now, one of the interesting things about doing these webinars, it's the 71st today, I repeat, one of the great things about doing these webinars is that we get to tackle subjects in depth. And the idea of security thought leadership is we debate today the topics in order that we might have a better type of security tomorrow. And we've got security in the healthcare sector, marginalised during COVID-19, or the centre of operations. Very proud and very pleased to be doing it with the National Association for Healthcare Security. And our three panellists, so I'm going to get to introduce themselves in a minute, Bonnie Michaelman, Barry Millett and Jane King, all have a wealth of experience. In fact, all three of them are extremely well known in their circles. So you may not know the three, but let me tell you, all three are very, very well known in their circles. And what I'm going to do is I'm going to ask each of them to introduce themselves. Once they've done that, I'm then going to ask each of them to make an opening statement. That's 4 minutes when they can say whatever they want about the topic. We're giving 4 minutes today because it's a little bit longer webinar. We go for an hour. And then once we've done that, we'll come to you, the audience, to ask questions. So please, can you use the question and answer button at the bottom of your screen? So hopefully you will be able to see our panelists, Bonnie and Jane and Barry. Bonnie and Jane and Barry, if they can come onto the screen. Barry and Jane. And just to say that on the hour, what we will then do is we're going to tie it up, and Jane and I think two people are going to come back and they're going to do a summary. of the day's activities. So the webinar then, let's get going and let's ask each of our panelists to introduce themselves. Bonnie, first you. Can you introduce yourself, please, Bonnie, all the way from the States? Bonnie, you're on mute, Bonnie.
That's going to be the expression of the year for the dictionary. You're on mute. Good day, everyone. And Martin, thank you very much for having me. I'm thrilled to be here. I'm Bonnie Michaelman. I'm the Executive Director of Police Security and some other things at Mass General Brigham, which is a 17-hospital system in mostly Massachusetts, but some other states as well, in New England, covering 100,000 employees and over several hundred facilities. I am a seasoned healthcare security professional with way too many years of healthcare experience to talk about, both in operations. I have done a lot of writing, I've done a lot of speaking, and I've done a lot of consulting around the world. I've been fortunate enough to be president of the International Association of Healthcare Security and Safety twice. President of ASIS International, and also president of the International Security Management Association, or known as ISMA. And I'm delighted to be here.
Bonnie, great to have you. Thank you very much indeed. Barry, please introduce yourself.
Martin, many thanks, and thanks again for inviting me on this panel. So Barry Millett, I'm Director of Assurance at Mighty, where I spearhead our global security operations, where we put intelligence, technology and people at the heart of all we do. I've led security and resilience teams across the globe for many multinational organisations for too many years than I try to remember now, unfortunately. I've also been an active member of ASIS International, where I was a UK chapter chairman, and I'm now Honorary Life Vice President of the UK chapter. Thank you very much, Martin.
Barry, thank you. And finally, Jane, can you introduce yourself, please?
So good afternoon, everyone. My name is Jane King. Martin, just to say thank you so much for today and doing the afternoon session for the NARS 2020 conference. I think this is a fantastic way for us to finish today. Two roles. So I'm here today as the president of NARS, National Association for Healthcare Security. And that's a volunteers role. All of the board are volunteers. We all have full-time jobs, and we do NARS as a daytime. My paid job is as head of security and site services at Guy's and St Thomas's NHS Foundation Trust. So most people have heard of Guy's St Thomas's, based in central London. St Thomas's is opposite the House of Parliament and London Eye, and then the Guy's Hospital is next to the Shard. So two very iconic locations, and I will talk about those later. So other mischief that I get up to is I'm a board member for the Security Commonwealth, and the Security Commonwealth is an umbrella organisation of 40 organisations, bringing those together. I'm an advisory board member for the International Foundation for Protection Officers UK, and I'm a fellow of the Security Institute. Thank you.
Jane, thank you very much indeed. Well, that's our panel, everybody. Now, can I just say that we're going to listen to their opening statements. This is where they can say whatever they want to about the topic, their ideas and thoughts on the issues. And then we're going to come to you, the audience. So could I ask you to use the question and answer button at the bottom of your screen to ask your questions? And can I ask you to get your questions in early, because we'll endeavour to incorporate them the sooner you get in. So please use the question and answer button at the bottom of your screen. So let's, without further ado then, go to Bonnie and ask Bonnie for your opening statement. Bonnie, please.
Thank you. I'll try to be brief, although there's a lot to talk about. Who knew in February, even when we were hearing about some of the issues China was having, that it would be so pervasive and so quick that this pandemic would affect us? And I've been through a lot of challenges in my healthcare career, but I have to say this is one of the toughest ones, mostly because of the longitudinal nature of it, mostly because it has so many different impacts, and because people don't love living with ambiguity, and not knowing how or when this is going to be over is very, very tough. I started when we realized that we were getting cases of this in this country, putting together a plan with my senior people, green, yellow, and red plan. Our incident command was set up, but the plan was what we would do if we got some cases, what we would do if we had to lock down the hospital in some areas. And right now I'm talking about our largest hospital of the 17, which is Mass General Hospital, and where we have 30,000 people and the largest research program in the world. We went from that green to red. I thought we'd have a few months to go to it. We went to it in a few days. That's how fast this happened. And as well prepared as I think we were, and many of us are, in emergency preparedness, I would contend to you that people don't do a lot of preparation for longitudinal disasters, for things that last a very long time. We had issues with a surge of very ill patients at the top of our mark. Other than a few hospitals in New York and New Jersey, we had more very ill COVID patients than anyone in the country. We had 500, of which 350 were on ventilators or what's called ECMO machines, which are pretty much at the end of life. If we had to restrict access from 80 entrances where 60,000 people come in and out freely every day to 4 where everyone was screened. We had significant issues with changing other people's healthcare who couldn't get healthcare that needed it, with staff that were traumatized and upset and had to be redeployed into COVID units, converting 12 of our medical units to additional ICU units, to thinking about vendor policies, stopping all construction, for 1,500 vendors that come in a day, having to figure out who was essential, who was not, changing our visitor policies to not allow any visitors, setting up mobile hospitals. We set up the Boston Convention Center with 1,000 beds, 500 for homeless people that might have COVID and 500 for post-acute COVID patients, and trying to staff that. Commandeering a hotel in a community that was extremely high, rich and high, had high statistics for COVID proportionately, so that we could put people who didn't need to be hospitalized from families who had COVID in that hotel, so that they weren't infecting, 7 or 8 or 9 people living in a small space in that community, and doing testing for that community. Supplied, so a lot of changes, as you can imagine, transformation of the hospital, of our satellite sites, of our staff. Many staff wouldn't come to work. We have 11,000 people that take public transportation to work. Well, they completely reduced the public transportation, and even what they had left, you might imagine nobody wanted to take. So we had to figure out how to get them to work, how to find additional parking spaces. And all of this may sound like it wasn't a big deal, but it was a very big deal in trying to do this. We had to set up a labor pool so that people were able to do other people's jobs. So, you had plumbers who were learning to wash dishes and other people learning how to take blood and all kinds of things. And then in terms of security risks, we saw some interesting trends. At first, we saw violence and security incidents go down significantly, particularly in the months of April and May, when we basically weren't allowing anybody in the hospital except those patients that had to be here. There was no one around. There were most services weren't happening, other than we were filled to the brim with very sick people. Very sick people don't usually commit crimes. So we saw a vast decrease in violence and incidents. That changed a lot in June when we started opening things up. We've had major issues with supply chain security. We've had major issues with blood shortages. We've had a lot of issues, believe it or not, with great people that wanted to give us donations, food donations, shoes. A company wanted to give us 30,000 pairs of running shoes. PPE, and all of that had to be cataloged, had to be quality controlled. We had to figure out how to distribute it, where we could put it. So that took a challenge. We've had massive issues, and I heard Martin talking about this earlier, with fraud, with extortion, with some cyber attacks, with people capitalizing on the vulnerability of this time and how busy people are. We had, for example, a major issue with fraud against a lot of senior physicians and surgeons, obviously, who had gotten some information that, and it wasn't just us, this was nationally, but clearly hoping that people didn't have time to check their bank accounts and other kinds of things. Workplace violence has gone sky high in the last few months, because with each ongoing month of this pandemic, and we're on month 9 or 10, as you know, people are starting to get less rational, have less services. There's facilities that we were able previously to send ill people to, behaviorally ill people or substance abuse people, opioid people, that we are not able to because they're closed or they're so full. So our emergency departments are brimming, they're overflowing with patients that have some serious complex challenges. That's creating some issues. And we're also dealing with COVID fatigue. And COVID fatigue is not insignificant for everyone in the hospital. Everybody has been working harder than they ever have before. They've had to do jobs they've never had. It's taking a toll. Personally, people have issues they're dealing with. Naturally, if work is also a stressor, that's a double hit. We've had tremendous opportunity. And to Martin's initial point, is this where security is minimalized, or are we able to, what I call, strut our stuff? I think this is an incredible opportunity for security operations to show their agility, their flexibility, their resilience, their creativity, and their ability to step into other lanes and to be unbelievably valuable and integral to the entire healthcare operation. I think anyone who's not doing this right now is not doing their job effectively, because that is the win here. I know that we were well reputed before, but we are going to have a reputation that nothing else could have positioned us for because of this pandemic. That doesn't mean that it's easy. It doesn't mean we don't have morale issues and a lot of operational challenges. But I think that's important. Lessons learned, obviously, plan for the worst, do a lot of longitudinal drilling. The continuum of fear changes. Some people are extremely paranoid, extremely scared. Other people are loose about it, as you know, and you have to be mindful and respectful to where people sit on that continuum. You have to show people what's in it for them in terms of those working and why this is going to end at some point. We are going to be back to whatever is our normal. We're going to be stronger. We're going to be considered more valuable. We're going to have been more creative. We're going to probably be given new opportunities and challenges and things to do. Communication is critical. As hard as it is, I think one of the most difficult things is not connecting with people as much. And I think you have to try to make every opportunity to ensure your staff and you are connecting with people, even if it's by phone, but not just on Zoom or on email all the time, because that's what helps to fuel people and helps people to remind people that they are still so important and they're still part of a very critical team. Systemic changes, technology changes, obviously we're learning a lot. Managing emotions and exhaustion, we're learning a lot. And this is going to continue. I think the hardest part is the fact there is a lot of ambiguity around when this is going to be over, and it won't be on a particular day. It'll be iterative, as we all know, and there will be challenges around the vaccination distribution. Most of the vaccination innovations right now are coming out of Boston, and I know a lot of people in these companies, Pfizer and other companies, that are seeming to lead the pack, and it's not going to be simple, as we all know. So there'll be ethical challenges, security challenges with that, and so we have to be at the ready. We have to get our energy up. We have to get our innovation up, and we have to show that we are there to do whatever is needed. So thank you very much.
Thank you, Bunny. I'm going to immediately go to Barry and your opening statement, Barry.
Martin, many thanks. In my personal view, the involvement of security companies and security personnel has really truly come to life during the COVID pandemic response. With many security companies and teams involved in the setting up of Nightingale hospitals and also the regional testing centres, which have all brought their specific challenges, not only from the varied facilities that are being used to house these operations, from exhibition centres to car parks and also the car parks of care homes, not naturally set for a secure and also a healthcare setting. Many organisations such as Mighty have been supporting the Department of Health and Social Care in their response to the COVID pandemic. Not only is there the challenges in actually setting up the logistics of these operations, which is no mean feat, and I take my hat off to all the teams that have been involved in these, but also very often our frontline heroes, and they truly are frontline heroes at these facilities, often have the frustrations of the public being taken out on them as well. And the frustrations from the public mainly around the overarching response to the COVID pandemic. These frustrations are very real for many people, and very often our security teams on the front line are having to engage in really deep conversations with these people to try and allay their fears and actually get them through the testing program safely. But also, criminals have also eyed up these facilities as well. At the height of the start of the pandemic, we saw all the challenges around getting PPE to the right people at the right time. And we saw a real increase in both subversive action around people posing as legitimate couriers to try and intercept PPE, but also brute force attacks on facilities that were storing them as well. And then on top of that, there's a lot of people that feel that, still feel that COVID is fiction and is not real. And you've got lots of activists that, again, that are targeting these facilities and really questioning why they've been set up and why the government is spending a lot of money in these facilities up and down the country. So some real challenges, not only in the actual setup of these facilities, but also the manning and the interface with the public. And our two teams, I believe, collectively, are really true frontline heroes who are facilitating the national response to COVID. Partnership working has truly always been a long topic that Martin and I have discussed over many, many years. Too many to remember, I think, Martin. But I truly believe that in our response to the pandemic situation, different providers have truly come together to make sure that we understand the risks and the threats to our operations, to enable us to be able to share best practice and make sure that we give our teams on the front line the tools and the wherefore to actually operate them safely and effectively. But not only have key partners and providers come together. As I stated right at the beginning, we're here to support the Department of Health and Social Care's response to the pandemic. So there's some true response and true partnership work in there. But also from a police standpoint, both from a national and a local position as well. I've seen some brilliant work being undertaken by everybody with people working together that perhaps wouldn't really have normally recognised the importance of public-private partnerships. I believe that the security response to the COVID pandemic has really increased the perception of security for the better. In my view, that was needed long ago. But I also believe that we need to keep our foot on the pedal, learn from all of the developments that we've had to implement on the fly at speed as we've been responding to the pandemic, and make sure that we keep that private-public partnership working in more aspects of our work outside of just the COVID response. So Martin, I think in closing, we've really stepped up to the mark, I think, as a nation, as a whole. I think there has been some real learnings from it. Yes, some of us have made some mistakes, but if you'd have said to me this time in 2019 that we would be in this situation, I think many of us would not have believed it. So we've had to learn on the fly, we've had to adapt, and we've had to overcome some of the normal ways of working. I just hope that we continue this going forward, and we also continue to recognise our true frontline heroes, and also continue that really close partnership working going forward. Thank you, Martin.
Barry, thank you very much indeed. Just say to the audience, if you could get your questions in on the question and answer button at the bottom of your screen. As soon as we've heard from Jane, we'll come to you and we'll get some discussion going. So 2 excellent opening statements. We're going to get a third. Jane, over to you.
Okay, thank you very much, Martin. And yeah, those 2 opening statements are fantastic. Just got to say, I was listening to Bonnie, and everything she was saying, it was that's how it is for us. So completely mirroring experiences, even across the Atlantic. So fantastic insight there. So when looking at the title of the panel discussion, you know, whether we've been marginalised during COVID or the centre of operations, I think, and most of the colleagues that I've spoken to would say that security in healthcare is fairly integrated into the fabric of the organisation anyway, and therefore that establishment is there. And I think what COVID has done is just actually bring that more to the front. That's certainly my experience in my organisation, and from speaking to colleagues around the country, that's fairly much what I am hearing. So from my perspective and the organisation I work for, as I stated earlier, we are a central London location, but it could be the same for any inner city healthcare premises. And therefore, we've been involved in numerous major incidents and other incidents, so Westminster, London Bridge, but also to recognise the heroic efforts of our colleagues in Manchester, more recently, a couple of years ago, and that brings together the relationship and the working with clinical colleagues under those situations of stress and adversity. So this exposure also means that as healthcare security, we are well versed in the rapid lockdown of premises to enable the trust to maintain its integrity of its site to deliver its primary function. And its primary function is the delivery of healthcare. And we need to make sure that that's what we do. We keep our people safe. That includes staff and patients inside, whilst we deliver our primary core function. And security is absolutely integral on that. So for me, the relationship is there. We've established, and we are established as a core service. However, as much as we did desktop exercises, etc., none of us were prepared for COVID and the social implications of a global pandemic, and what that would mean for us. My own hospital, Guy's St Thomas's, actually we're a HSID centre, which is a highly contagious infectious diseases centre. So we are used to receiving patients who have to be kept in isolation. We have an excellent clinical team who are infection control specialists. So you'd have thought of anyone, we would have been ready. And we would have been if it had been a few. However, what we weren't ready for was for the national way that it played out. So people always refer to lockdown, and I think the pivotal point of COVID is when the UK went into lockdown, which was 23rd of March. But actually, in London, we'd been receiving patients since probably about February. And we'd seen, and although not quite on the scale, so we were starting to gear ourselves up for it. And then the national lockdown took us into a completely different place. So there were issues initially with the logistics, and some of the issues around PPE have been well documented in the press, and there have been other discussions around that. But what we started to see was the role of the health service security officer evolving. And how we saw that was the implementation of our resilience plan. Part of that was to increase security resources. So at my own organisation, we looked at the senior team, and we put the senior team onto 7-day working. and made sure that we were there to support our staff on the front line. And we have to make sure that we all look after each other. And we recognised at that stage, actually, this wasn't going to be a quick 24-hour, 48-hour major incident, and we'd all go home and be happy. Actually, we were digging in for a bit of the long haul there. So some of the things the immediate changes we saw was the definition of critical assets. So in healthcare organisations, there are some key things that are integral to us operating. But of course, the pandemic completely changed that. What we saw all of a sudden was a critical asset now was PPE. People wanted PPE, people wanted masks, people wanted hand sanitisers, and they are everyday commonplace piece of equipment available everywhere in hospitals. So we had to think about trying to secure some of those, and that meant not only looking at what was available in the hospital, but also the logistics and the delivery of those items to each organisation. We also heard stories of hand sanitisers being ripped off stations, from walled entrances, general corridors, etc. And also there were reports of staff being mugged for their robbed for their trust ID, because with the trust ID you could have priority placing in getting into large food shops, but also there were lots of organisations offering discount on production of an ID card. So again, the simple ID card became part of the critical assets. And then, of course, we have the medical gases and the resources and the security of the infrastructures. We saw the emergence of the Nightingale hospitals, and the first Nightingale was in London at the Excel Centre. Barry alluded to exhibition centres being turned into hospitals. The Nightingale was vast in that the North Wing and South Wing were 2,000 beds either side, and it was actually built and created in days. Absolutely amazing feat. Wasn't just the NHS, it was private, contractors, the military was involved. A fantastic national effort and produced a wonderful thing. But you have to look at where is the plan to do that, and actually that blueprint should then have been taken and used for the building of Nightingales nationally around the country, and that didn't quite happen. So part of the security response was also to plan for staffing reductions, because with a pandemic, this is going to affect our people as well. So in my own service, we had to look at and advise what we could deliver with staffing reductions of around 25 or 50%. So initially, if I lost 50% of my team, what service could I deliver to my organisation, and what service would we say actually that we can't deliver? So they're what I'll call the negatives. But I think that COVID gave some real opportunities, and I think Bonnie spoke about those earlier. So whilst we saw some security sectors, the hospitality sector in particular, decimated, what it did provide was a workforce that could be tapped into to support security in healthcare organisations. So we have some major hotels near us, and obviously the hotels weren't open, even though as an NHS we were using it for our key staff. So there were lots of security staff there who would have been furloughed, so are working as part of the team on perimeter. So these people who are local to the area, local businesses, they know the area, they know the issues in the area, and now they're supporting a national effort. A complete win-win if it's geared properly, and we need to make sure that we keep that relationship going post COVID. Also within the organisation, we saw multi-skilling in hospitals. Again, Bonnie alluded to it earlier, where we were taking staff out of other areas and seeing how we can multi-skill them into. So we took finance staff and we put them into portering. We took some other staff and put them into food service assistants. Everyone was involved in the effort to look after our patients. So going forwards, one of the other positives was actually the recognition of security staff as key workers. So this is a game changer for us, and this is where we really need, I think, to seize the moment and promote that. That there is the campaign, the perceptions campaign, and that is around the use of language. In healthcare and NARS, we always will refer to our security staff as officers, and we won't use the terminology of guard, and we are promoting that quite forwards. Going forward, it's evolving always. What we have learned is about the real value of risk assessments for our staff, individual staff. We know that our BAME staff and those staff with pre-existing health conditions have to be looked after more around COVID and more susceptible to COVID. And it's about how we look after those staff and what other roles that we can put those on while still maintaining them in the organisation. How we've evolved is now that our security staff, we have done social distancing around the hospital, which is no mean feat, particularly in the lifts. We have lift marshals. We have people at the main entrances to the door, like Bonnie, just a couple of entrances for each building, where we get people to hand gel and issue masks. And also it's then about the controlling of the access and egress. Likewise, just want to talk about violence. COVID was probably the most impressive violence reduction scheme that I've ever seen. But unfortunately, with the opening up now again and trying to have some semblance of normality with business as usual, our violence levels are now back to the same as they were pre-COVID. So we need to work on that. There is lots of frustrations out there and people are angry. I think people feel their liberties being taken away or eroded. I'm seeing anger levels like I haven't seen in quite a long time. So that's a huge challenge for us. But overall, I think we will get through this all together. I think we will become more embedded in our organisations, and I'm hoping not just in healthcare, but in the industry as such, the recognition for security is finally there on a national level. Thank you, Martin.
Thank you very much, Jane, and plenty to go on there. So let's go quickly to the questions. 3 excellent opening statements. Normally, you know, I'm quite ruthless in terms of the time allocation, but I let it go because there were so many important points, and it's a special one today. We've got a special subject matter. So let's keep going then. So Bonnie, I'm going to come to you first. And the question from Martin Clark is about, okay, we are where we are. Going forward, what do you see as the biggest risk that security is going to face as we move to this so-called new normal? Bonnie, looking forward now.
I think the worry I have the most is that we will compromise the foundation, the infrastructure, the things that we are proactively doing because of different needs for our team because of COVID. I know, for example, that we are not in all of the places we were. We are not able to do some of the proactive activities we did. And that's going to give license to people with nefarious intent to do the things they do. So I worry about that very much. I think we have to keep our eye on the ball in terms of what are the basics. To Jane's point a few minutes ago, I think making sure we're doing risk assessments, that we are constantly aware of the trends and how they're changing, gathering intelligence from our outside agencies. To Barry's point about our work together with public-private partnerships couldn't be more important right now, so that we are all together navigating this toward a common goal for crime reduction and risk reduction, and looking at enterprise risk in general and how in this mode we need to think about this differently than we might have before.
Bonnie, thank you. Barry, your thoughts? You come at this from a slightly different perspective.
I think, Martin, my view is on this is making sure that we're not being blindsided whilst COVID is the biggest game in town. There are a number of other risks out there, and we've had the the recent increase in the terrorist threat level in the UK, as well as a stark reminder that there are other issues out there whilst we're responding to COVID. So I think it is making sure that organisations and individuals are not just being blinkered on responding to COVID, keeping an eye on the intelligence that's out there around other activity, whether that's terrorism, whether that's organised crime gangs. It's really important that we don't take our eyes off of those balls as well, Martin. That for me is the biggest risk.
Thank you, Jane. I'm going to ask a little supplementary question with you. Martin Clark's also raised the issue in the UK, Jane, about smoking, people not being able to smoke, and this causing violence. None of you mentioned that. Just a little bit of thought on that, Jane. You're on mute.
Yes, it's the dreaded smoking question, isn't it? You know, healthcare premises have or they should have been smoke-free for many years now, but we still see it continue, and sometimes, you know, it's understandable, particularly when we have patients who may be having a crisis. We have mental health patients, etc. You don't particularly want to ask them to walk off the premises onto the public highway. But I think generally it's right, and I'm not sure just because we have this pandemic or whatever incident it is that we go against the grain on that. We've made a decision that we are going to be no smoking premises, and as everyone knows, smoking is the one thing that people can do that improves their health. Without a doubt, and we are healthcare premises. For me, it's just not about the person who's smoking, it's about the environment. We have a children's hospital on one of our sites. It's about everyone else who has to walk through that. So I say it calls for a lot more diplomacy from the security, and I think if COVID has taught us anything, it's about our interactions more so with the public and about our empathy. But it is, and people talk about enforcement. I don't talk about enforcement. I talk about encouragement. So it's encouragement for people to do the right thing, and that's done on the approach. So we need to upskill ourselves, and I believe that we have, and rapidly, in the customer service, and encourage people to abide by the policies and processes.
Yeah, Jane, thank you. Bonnie, I'm going to come back to you, and a question from Rod Townley. You touched on this, but he asked the question, how has restricted access, which you did talk about, impacted on both patient well-being and agitation and aggression from visitors? One can imagine this is getting worse, I suppose, or is it? And how do you roll out a strategy or a policy for responding to that? Because I assume this is the case across the board. Bonnie?
Yes, it's probably our biggest challenge right now, particularly with the colder weather coming, because we're not allowing many visitors at all. And so we've asked people to wait outside because we want to minimize the number of people in our hospitals. And we want to, you know, for staff safety as well as patient safety. People were comfortable with that in the summer. They're not going to be as comfortable in the winter. And many people naturally want to be with their loved one when they're getting bad news for a cancer diagnosis or going in for a colonoscopy or whatever they're going in for. And there are exceptions to the visitor policy, of course, but people get very upset, particularly emergency department patient visitors. And that's really a challenge because, you know, with 150 or 200 people in our biggest emergency department, we simply can't have that many visitors go back with them. So again, I think that, you know, to Jane's point about diplomacy and empathy, and we're so lucky I have such an amazing team who uses a lot of compassion and a lot of negotiation and tries to connect with them and give them options to do that. And usually it works, sometimes it doesn't. But I think most people, if you explain to them why you're doing what you have to do, they appreciate that and will kind of comply, even if not particularly happy about it. For those that can't, we have to be a little more bold and you know, take care of it, because right now the objective is to keep the environment safe for our patients, visitors, and staff. And it's very hard with these numbers rising the way they are.
And Barry, I think you touched on this as well. Well, you did touch on this as well. But Barry, your thoughts. So show compassion, show understanding. Sometimes you just got to be bold, Barry.
No, absolutely. And I think, you know, The change in the weather also is going to have its own challenges, especially for the outside testing centres as well. And we're really mindful of that, but also the testing, how you book your testing slot has been refined to make sure that we get the right number of people through those testing centres at the right time, and that there isn't a backlog. But, and I noticed Brian Sims had a question earlier on.
We're going to come to that in a minute, Barry.
Okay. And I think, you know, most security teams have empathy at the heart of they do. The vast majority of their time, they're providing customer service to people coming into those facilities, whether they be offices, whether they be healthcare hospitals, or whether they be the temporary facilities such as the testing centres. So I think they are naturally provide that empathy, provide that customer service to be able to allay people's concerns and actually get them through the process safely and securely. It's not easy because they have a wide myriad of different people that they're interacting with every day, and I take my hats off to them how they're actually interacting with the general public on a day-to-day basis. But I can see as the weather changes as well, those challenges are going to be increased also, Martin.
Okay, thank you. Jane, I've got a question here. Now, this is an interesting one. It's an international webinar, and we've got people from all over the world attending. And the question from Michael Odu, and I hope I pronounced this well correctly, Michael, is about a problem faced about swapping newborn with another newborn based on sexual preferences. In other words, babies being swapped. Now, I assume, I'll ask you that direct question, Jane, but more generally, the sort of question about being distracted, so that making sure you're looking after all parts of the hospitals. Your thought on this specific issue, Jane?
Yes, I mean, to be honest, anything to do with babies is the one that gives most healthcare heads of security the real hiccups, because that's the stuff that nightmares are made of. So we all, you know, the babies, and as I said earlier, we have a children's hospital. So it's about the processes that you have in place, and it's not all technology. You know, I know some hospitals will have baby tagging. You know, they will have facilities where all the doors lock automatically, etc. But the best piece of the toolkit that you can have is the staff, and the staff awareness, and the staff training, and the staff taking responsibility. It's their unit, they are their patients, and that has to be emphasised. Everything else that we put in place is a support. So they can't say, oh, well, we've got baby tagging, we don't have to worry about that. So, you know, there are hospital procedures about the babies having bands on and etc. I don't want to go into all of it. But all the systems that we will advise will be supplementary to that, but it'll be about good processes. And we work really closely with our maternity services, and we do drills and skills. And that's looking at the what's if and how do we react to that and various scenarios. So we work closely with those clinical teams and, you know, and try and work out what we would do and what our processes are and keywords for activating if there's an incident. So that's just the ongoing training and the working together.
Thank you very much indeed. But I'm going to come back to you on training. As you say, Brian Sims has raised this point, and it sort of goes through a few of the other questions. Did you have to step up for a different type of training of staff in this environment, or is it doing what you've always done, just in a slightly different context?
I think it's doing what we've always done in a different context, Martin, but we implemented some specific training for the teams during the mobilisation of each of those sites, and then also implemented some additional toolbox talks to focus on any specific emerging issues as well. And I don't think that's any different than the normal operation of most security teams, to be honest, Martin. It's just in a different setting. The spotlight absolutely is focused on the healthcare settings at the minute as well. So it's making sure that the security teams realise that the spotlight's on them. So it's doing some additional training when we're mobilising into these specific environments, and then also implementing some specific training through toolbox talks when specific issues start raising their head as well.
Bonnie, same with you, same training, just different context?
I would agree with that. I think the other piece that's very important here that hasn't been ever done this much is real collaboration, so that with nurse leaders and nursing and physicians and support staff, so that everyone is integrated into protocols and enforcement, or encouragement. I like that, Jane. Or to ensure protocols are being followed, to make sure visitors and patients are doing what they should, because now more than ever, it really takes a whole village to get this done.
Do you say, no, but the thing is though, Bonnie, was it difficult to get any funding for this, or is this easy at this time? I'm just wondering about the realities of this, because it's always funding is the issue about training, isn't it? That's the barrier, typically.
Well, I mean, the fund, because this happened so fast, nobody waited to get permission to, people did what they needed to do. We assessed what we got. We tried to get federal funding, and obviously we've also made some of it up because so many people came back after the pandemic. But to imply there's not a loss would be foolish. There's been a loss for healthcare everywhere. Yeah.
Okay. Thank you very much indeed. Jane, I'm going to come to you for a question now. Let me tell you something, panel. When you did your opening statement, I bet all of you will say how well security's done. And of course, you're all in positions where you've had a bird's eye view, but not a surprising opinion. But let's just take that as an unqualified good for the moment. Michael Cummings asked the question about how we leverage it from here. Because on previous webinars, what we've been hearing, similar things, security's performed well on the front line, but others have said, but wait a minute, there's economic hardship coming, and just as security is popular during a crisis, so it's also immediately cut back during economic hard times. This always happens. So be careful, security. You enjoy your time now, but don't think this is going to last. When economic hard times come, you're the first to go back in the box, so expect it. Jane, how do we harness the good times? You've gone on mute.
Sorry. Okay. Yes. Interesting. But I think we will, and I think we have an advantage in healthcare. Certainly in the UK, there's been a great swathe of support. Well, particularly the first wave for the NHS. And security as key workers are obviously part of that. I think for us, we need to look at what it's actually given us as individuals. It's given us this ability to be able to evolve and to multi-skill. We are using parts of us that we have never used before, and we are being involved in things that we could never have thought about. So it's about us grabbing those opportunities and absolutely harnessing it and making sure that we use it, and also then that we bring our teams with us.
How though, Jane? How do we do it? The question is, we know we got to. The question is how. Yeah.
Because by showing what we do now, so some of the things going forwards on a national basis, it's an opportunity to pick up on the theme of the fact that security are key workers. It's to pick up on the perceptions campaign, where we're talking about security officers, not security guards. It's about raising the profile of security across the sector, and that's by professionalising ourselves. It's our industry, we have professionalised ourselves.
Yeah, okay. I'm going to ask all three of you this question. Let me come to you next, Barry. Okay, so you've all done very well. How are you going to make it last?
I think by doing something that we've not been very good at doing in the past, Martin, and that is about shouting about the successes. All too often, the conversation has been around failures, security failures in whatever way. And I think for us to really harness the power of how we've sort of springboarded the perception of security through this horrible pandemic is really about shouting about those successes, about how security officers have adapted to the changing environment, how they've also adapted to managing specific risks as they developed through COVID, but also whilst keeping an eye on organised crime and petty criminality, and also, unfortunately, as I stated earlier on, with the increase of the threat level as well, making sure that we don't lose sight of some of those traditional threats. So I think the key biggest thing, Martin, is about us all really championing all those good stories and also harnessing those case studies into business as usual going forward.
Okay, Bonnie, you outlined a whole range of ways in which you said that security have performed well. How do we harness it going forward? Very specifically, what needs to happen next? This is Michael Cummings' point, and I know you know Michael well, but a very good one.
I'll answer my friend Michael, and I certainly agree with my colleagues. I think the way to do it in part is by data and storytelling for our senior executives, first of all, so they understand the challenges that we're going through and how we've handled them, and data to show what could have happened had we not been handling them as well as we could have. Certainly making sure our staff people understand this and are empowered to talk about this with other people and other colleagues that they interface with. I think there are ways of helping people, empowering people to be leaders even without promotions. So I think I've seen a lot of empowerment of our team in ways that never have happened before. Making sure we're communicating everything we're doing, why we're doing it, why it's working, and why we have to keep doing it matters. And I think it's just repetition in part and continuing to tell a story and helping people to understand what would happen if we weren't doing it in this way.
Okay, thank you very much indeed. Jane, back to you. A question from both Mark Rowe and Wesley Burton. And I'd like you to be fairly quick if you wouldn't mind on this, Jane, because we're running out of time. But they've both asked about whether the security brain in the health service has gone with the disappearance for an international audience of the central hub of security management activity in the health service. Jane, have you had an intellectual security vacuum in the health service, or are we fine? Jane King.
No, I would say, if anything, and having been in the industry for 29 years, I don't think we've ever been in a better place. So out of this awful incident, what people are doing and the way that people are talking together and sharing information, I just don't see that we've ever been better. The one thing that we want to say is where is the national leadership? And whilst we don't have that, NARS will step into that. But we have got some absolutely phenomenal people who are leading the way on this and are inputting. So I think we just couldn't be in a better place going forwards. Okay,
thank you very much indeed. That was very positive, actually. Let me come to Barry next, and a question from Paul Evans. This is a question about the pay of frontline officers. Now, this keeps coming up, okay? I've got to tell you, because in some ways, security officers on the front line dealing with all these issues. Barry, was there ever a problem, and I'll come to Bonnie after this, was there ever a problem, Barry, about frontline workers' pay being low? And is this going to change because of the pandemic? Barry?
No, I think Mighty as an organisation has always put pay of frontline officers at the forefront, and that hasn't changed through this response to the pandemic. But what we have also done is increase some of the additional benefits for our security officers as well, is making sure that everybody has access to statutory sick pay as well, which is not always the case, and also implementing access to private GP facilities as well. So I think we shouldn't just always focus on the pay. Absolutely, all of the frontline team need to be paid the right wage for the work that they're doing. And so,
are they getting it, Barry? I mean, is it a problem in the health service?
Not that I'm aware of, but obviously, Martin, I don't specifically work in the healthcare sector, but certainly from my understanding of what we're paying, it's not an issue. And as I said, it's not just about that single pay point as well. It's also those ancillary benefits as well, which are as important to some of those frontline personnel as well.
Bonnie, same for you. I'll be interested in the situation over there, Bonnie. We hear a lot about this frontline pay issue. Was it a problem in the health service, Bonnie? And have things changed because of the pandemic?
I think it's a problem, and I don't think it's changed because of the pandemic. There's great disparity, as you know, there's contract services that don't pay very much for these people to be working in a very vulnerable environment, and a lot of proprietary services pay quite well, and benefits are extremely good, which is very important, and recognition helps. If there's not a career pathing, if there's not good benefits in retirement, if there's not real breadth and depth to functionality in the job, people aren't going to stay. And I think what's difficult these days is, you know, and I've had a couple people myself who loved working here, but they said, you know, they came and they quit because they got a $20,000 a year increase to work in an industry without people wrestling with them in the emergency department and without worrying about catching COVID. And it's hard to argue against that.
Yeah, absolutely. So do you, Bonnie, is there a route to using what's been going on in this crisis in terms of all the good things you've spoken about to address that specific frontline issue, pay?
I don't think that we're going to be able to use COVID as a way to get greater pay. I think as good security leaders, we should be doing that each and every day, because there's disasters, there's crises, there's emergencies, and there's major work people are doing and taking their lives in their hands every day. So I think if we're not doing our place in getting good data from other places and figuring out what people should be paid based on the risk and the functionality, then we're not doing our job. We should not use COVID for that.
Thank you, Bonnie. Thank you. Right, let me ask you each for a final comment. We're getting near the end. We've not managed to get through all the questions, but we've done a pretty good job, and we've covered a larger territory. Let me ask you this question. One of the issues we've been hearing about on previous webinars about how in the healthcare, of course, there's been chaos. There's been a lot of disruption, let's put it this way. And that puts security in a rather interesting position, that it's had to cope by operating in chaos where people have been focusing on other things. What do you think for going forward is the single biggest opportunity for having a better security in the future? Thought leadership is about this. Where's the route from where we are now to what might be better in the future? Barry, let's come to you first. Just 30 seconds if you wouldn't mind, Barry.
I think it goes back to one of my points earlier, Martin. It is really making sure we harness true partnership working. I think companies and individuals working in isolation will only achieve so much. The power of the whole is much greater. And I think by harnessing that more going forward, then we will truly make a step change. Okay.
Bonnie, your thoughts on this?
I think that we need to constantly be looking outward as well as inward as security leaders. I worry now we're so busy with our jobs, you know, and with associations not meeting, that we're not always thinking proactively and innovatively about other things beside this. And I think we just have to continue to show the breadth and depth and functionality of what we do in every way. And show that the value of that is immeasurable.
Okay, seems appropriate, Jane, to since we're doing this with the association and you're with the association, we've the final thought to you, Jane.
Thanks, Martin. I just want to say I think you're absolutely right. I think the big thing for us going forwards is that we need to make sure that we don't look inwards, that we do still maintain those partnerships and relationships outside, particularly our links with information exchanges and business watches and understanding what's happening outside our front doors. But I do want to also make sure that we seize the opportunity for professionalising healthcare security, and that will link in with some of the other issues. So we need to look at career pathways and qualifications on that career pathway, and then hopefully that will enhance the pay structure.
Jane, thank you very much indeed. Well, panel, thank you so much for your time. Thank you, the audience, for your questions. That was a very engaging topic. Many issues there that we'll be picking up within future webinars. But don't go away, by the way, audience. You've got another little bit more to come. But thank you very much indeed, panel, for your input. I really appreciate your observations. Fascinating conversation. The good thing about thought leadership is we throw out ideas for the future, we raise questions, and leave plenty more to be answered. We've certainly done that today. Just say from my point of view, we'll be back again with webinars. As you know, they're every Tuesday and Thursday. For those who are not used to these, we're here every Tuesday and Thursday. So we'll be back on Thursday with another. Where are we now? No, we're on Thursday. Next Tuesday, I'm losing track of the week. Next Tuesday and Thursday with two different subject matters. We're looking at raising security awareness on Tuesday and the challenge of delivering security services across domains areas during COVID-19, across the world, in fact. So please do join us then. Back to our normal time of 3:30. Thank you very much to Hannah Miller in the background. Thank you once again to the panel and to the audience. And at this point, I'm going to hand to Jane and to Roger, who are going to sum up their day's conference. Jane and Roger, over to you.
Thank you very much, Martin. Thank you, Bonnie. Thank you, Barry. Really enjoyable. Roger, where are you? There
I'm here, Jane. I am here.
Yeah, no. I lost my screen.
That's okay.
Right. So there we are. We're on the final part.
Yeah,
over to you, Chair.
Yeah, I've got to say, and probably it's a different perspective, but I can't believe how quickly today has gone. You know, we started this at 10 with the AGM. We're now 5 hours on. To me, it seems like 40 minutes to an hour. I found the whole thing engaging from start to finish. I'm going to say that, obviously, aren't I? But I did, and I thought with the speakers that we had and the range of topics we covered, and I'll just give a brief sort of recap on that. I'll also pick up on the fact that the difference in style in terms of how the conference that was delivered this morning and the way that Martin did it this afternoon, I think there was, I think they complemented one another very, very well. And as perhaps you would expect, there was a number of common themes, even to when you went to Bonnie over the pond in Massachusetts, where, you know, I think she was very insightful. But we started off with, in terms of our speakers, we started off with Michelle Russell, who I also found very engaging and insightful when she talked about the development of Nightingale hospitals, which obviously you've had involvement with, amongst others, the huge increase in demands on overstretched resources, securing COVID and non-COVID areas, and first response, keeping hospitals and equipment and clinicians safe. She also interestingly mentioned our own health and well-being and the continuance of SIA, NARS joint work streams. And I just want to check, because there is a tweet from Michelle on LinkedIn where she says, I am humbled and privileged to be a part of the National Association for Healthcare Security Conference 2000, NARS 2020. Healthcare security has been more important than ever, keeping our hospitals and the public safe. Thank you. So that's what Michelle's tweeted in relation to joining us today. Any comments, Jane, on Michelle or the points that she made? Jane, I think you're on mute.
Okay. No, I thought it was a great opening by Michelle, and she totally set the tone for the day. I think the thing is that we need to remember that the SIA is a regulator, and there were lots of comments on the side, particularly comments around healthcare security and should it be its own license. NARS, as you know, has been pushing that for many years. We did so with the previous chair, and we will continue to do so. I'm told that will take legislation change. We will continue to push that. I think what became evident from Michelle is that, you know, they do see us as an integral key stakeholder. And yeah, without blowing our own trumpet, you know, our people have come into work day in, day out, and that is contract staff and in-house staff. And they have been here 24/7, no furlough for our security staff, totally on the line, given it that they're all, and I couldn't be prouder of all of them.
Yeah, and it will take a change in legislation, as we all know, under the Private Security Industry Act of 2001. There are a number of licensable activities, 6 I think in all, but there are also 2 exemptions to SIA licensing. One, of course, is in-house security, as long as it's not used to sell to other people, but also for security specialists for ourselves. We are exempt from licensing. I think we might look at that more as a bad thing now than a good thing. We then moved on to our first panel discussion with Dr. David Rubins, John Allen, and myself. The opening question was managing risks in security, which obviously you chaired, the new normal. We talked about things like strategic leadership of management, security management, changes to risk, high impact crisis scenarios, stakeholder working, internal, external partnerships, importance obviously having the right command and control structure and staff with the right technical skills and abilities. David's perspective was that there is a need to develop a culture of acceptance of security, as opposed to relying on legislation and regulation to force the issue. So rather than use the big stick approach, you know, quoting Service Condition 24 or other legislation, his view was obviously we need to promote and this culture within organizations. John came very much from an industry and infrastructure standard point of view, which he said would eventually be influenced by large companies such as Microsoft and Google marketing their innovative security management systems. We also examined various routes that we could take following the demise of the NHS Protect and the lack of investment by supervisory or regulatory bodies in security management. And people suggested things like the EPRR framework. So your view on that?
Yeah, I really enjoyed the debate this morning, and I think David hit the nail on the head, where, you know, and he says, do not, you know, rely just on legislation. There are various other ways, but I think, you know, it has to be part of a whole toolkit. For me personally, I think this is our moment. Okay, I think healthcare security, this is our time, and it is up to us as the industry leaders, which, you know, for all intents purposes we are, to lead the way. It is about making sure our staff do have the skills, that they are professional, and that they conduct themselves in the way that gives that confidence. You know, there is the perceptions campaign going on that we've spoken about, and that is about the use of the term, and it's around language of security officer. Get rid of the term security guard, but we have to live up to that title. So us as the managers need to drive that agenda forwards. So lots of us sitting in these positions would have done additional education, that there'll be degrees, diplomas, etc. But we need to create the next generation of staff. We need to make sure that apart from just the practical skills, that there are the educational pathways for people and to professionalize healthcare security. We're in charge of this. We need to make it happen.
I totally agree. So after lunch, we moved on to our second panel discussion, chaired by Professor Martin Gill, Bonnie Michaelman, Barry Millett, and obviously your good self, entitled Security and the Healthcare Security, Marginalised During COVID-19 or the Centre of Operations. Martin gave an insight on security from a criminal perspective, on why they may be deterred from crime, and how when incarcerated they share tips and best practice on how to commit crimes and who may prove to be the best targets. I think the analogy there, of course, was that we need to make sure that we share best practice and we have that dissemination of information. But as we've already said, with the demise of NHS Protect, and without a central body to map that and circulate that, it obviously makes that very difficult. So we may find ourselves in a position of weakness against the criminal fraternity, if I can put it that way. I thought it's the first time, I must say, that I've heard Bonnie. I've had the privilege of listening to Martin before. Obviously, we've had him at previous NARS conferences. I thought, again, that Bonnie was extremely insightful. She talked about, who knew in February. We were all reading what was happening in Wuhan in China, but who knew how it would affect us in the rest of the world. She talked about lockdown, extremely ill patients, cancelling visitors and outpatient departments, setting up satellite sites, staff isolation, transport issues during lockdown, retasking of staff and sites for different issues, blood and PPE shortages, fraud and cyber attacks, workplace violence and COVID fatigue, all very relevant subjects and a very deep insight into them all. Your views? I think you're mute again.
I must admit, when Bonnie went first and she just reeled off all of these things, I threw away about 4 pages of notes because it was exactly that, absolutely hit the nail on the head, and that again for me, so we know that we're similar, but completely across the Atlantic, and we are all going through the same issues. So this is where we talk about information sharing. So that network may not be there, we create our own. NARS is the national one. We will engage more with people like Bonnie and the IAHSS, and we will talk together and we will share what works and what doesn't work. I thought it was brilliant having Bonnie on there today. Fabulous speaker. But also Barry. We know Barry. Barry's been to a conference before with his CSSC hat on, and again brought a completely different perspective. Looking at the testing and the issues that they're facing are issues that we face on an everyday experience here. So really enjoyed the session, and of course brilliantly hosted by Martin as always.
Yeah, and coming on to Barry, he obviously talked about the setup of Nightingale hospitals and national testing centres, brute force attacks on NHS and other premises, and also fraud, all used to steal PPE. And as we've heard, there's been more fraud and scams during the period of during the period of COVID than at any other time. Many people believe that COVID is a hoax, don't comply with regulations, and state that it doesn't exist. So those were the points that he brought. Then we got on to your good self. Obviously, you talked about pre-COVID, other security terrorism issues in London and elsewhere. Interestingly, you mentioned about lockdown desktop exercises did not prepare you for a global pandemic, and I don't think that they prepared anyone for that. Which is always a good point to make. Staff individual risk assessments, social distancing masks and the use of hand gel. And I've got to say, my favourite from you was encouragement rather than enforcement, because I think that is the key, to ensure that you don't get an adverse reaction. And then, of course, it was talked about how do we map this moving forward, and it came back, I think, to Bonnie, who said data analysis, and I think she used the word stories, but to put it into our parlance, I'm just going to say a timeline. But I think that those are very relevant to take to our board to say, well, this is what happened, and this is how we reacted to it.
Yeah, I mean, I'm sure that everyone who's been listening today, most people, could say, yeah, I get that, and that's exactly what I'm thinking. And I think across the realm that we probably answered a lot of issues that people were talking about. It might be interesting, Roger, if we just see if there's anything on the I'm assuming you've got the chat, and anything on there that we didn't address, that maybe some themes. I'm not sure.
I think there were a couple of direct questions, but I think themes, we covered everything, I'm glad to say. What was most interesting, because obviously we've been talking about dire times, but Bonnie's view was this is security's opportunity to strut their stuff. Barry said that security has been elevated. We need to keep our foot on the pedal. And, you know, your view was how do we harness the good times? So as much as everyone's talking about the adversity and COVID, demise of NHS Protect, and the issues that we face, everyone's view is, but this is the time for us to come good and actually make a positive out of a negative.
Yeah, and just want to go back to one of the questions that Martin asked that stumped me for a bit. So it was about, is there the lack of the brain in the security management, bearing in mind that there's no centralised management structure? And I would say absolutely not, because in spite of there not being that centralised legislation and centralised government, etc., we are still going ahead and we are still talking. It would be nice to have that framework. It would be nice to have that structure. And actually, we should have that, but we haven't fallen over and died.
No, far from it. And you know, that brings me on to what I will talk about in a minute. But just to say, in the Q&A session, I mean, questions that were asked were, what do we perceive, or what did the panel perceive to be the biggest risks in 2021? And the answer was very much keep an eye on the basics, gather intel, you know, do not be totally blinkered on COVID, be aware of organised crime and all the other security issues and business as usual that we have to deal with. And that was a general consensus by the panel in terms of what we should be looking at in 2021.
Yeah, and definitely when I was saying earlier about we've got long established links with other organisations, you know, the SIA, and you know, the counter-terrorism business information exchange, and our own local business watches that we are involved in our areas. Keep those links going, keep speaking to those people, because they are your neighbours. And we need to make sure as neighbours that we look out for each other. So we may be a different sector, but we need to engage with our local business areas.
Okay, any other comments in relation to the conduct through the conference for the day from you?
Sorry, was that for me? I had a bit
Sorry,
of a,
yeah, that was from you. So that was for you. That was just to say, have you got any more comments on the conduct of the conference during the day, or any other observations you'd like to make?
No, I mean, I think I was so yesterday thinking about this being our first virtual conference. I was a little bit nervous, although I've been on other conferences and other webinars. This would be a first for NARS, and just wondering about how it would feel and how it would go. I think it's been a real success. I think it's allowed engagement for our members to get in. I think it's something that we will take forward. We will do on regular occasions some webinars. I think it will still be nice if we can have an element of face-to-face post COVID, but I think we've now found another resource, part of the toolkit for engagement with our members, and that sharing of information, and actually in a bit more of a timely manner. So I think today, personal view is, it's been a great success, and that is due to the efforts of yourself, Roger, and the executive, who've done an absolutely fantastic job. But also big thanks to Martin and our event organisers, All Security Events. Outstanding day.
Yeah, and that brings me on to accolades for the day. I'm in agreement with you. This was my first webinar. I've learned a lot putting this together. And I think that, you know, like you, I think there's a place for webinars. I think there is also a place for face-to-face, because what we've missed today is the engagement with our sponsors, exhibitors, but more importantly, I think the networking between us, the security managers, you know, whether that's over a cup of coffee in the morning, whether it's over lunch, you know, I've very much missed that networking, which to me is equally as important as what I learned in the day from the external speakers. But I think that there can be a hybrid. You know, I wouldn't be nervous, let's say, about saying, well, you know, so-and-so can't join us, they can't be with us in Birmingham today, but what we could do is a video link and bring them in for 15 minutes from wherever they are in the world. And so I think we can merge the two to come up with something better. As I say, I think as chair, it falls to me, and I will ask Jane for her comments, to give a number of thanks for today's event and putting it together. I just want to make the point that NARS, as I'm sure you all know, is a voluntary organisation. All execs and others that are involved with NARS give their time for free, which is, to be honest, always a challenge, but especially during COVID, it's been a particular challenge. As I said earlier, I was made chair of NARS this morning. If anything has filled me full of dread, it's now trying to fill the shoes of Jane now that she's moved to the position of president. Jane has been chair of NARS for 2 and a bit terms. What she's forgotten about security is more than I know. She can quote more acronyms of 3 and 4 letter organizations than I've ever heard of. Most of the time I have to go away and look them up. So all I can do on behalf of all NARS members, Jane, and the executive, is to thank you very much for your service and continued service. And I will make the point to the membership that I did make the point that unless you stayed on as president, I wouldn't accept the position of chair.
Okay, that's very, very kind. And normally at this point we go off and hug and have beer. So that's one of the big downfalls of virtual. But we will store that. Okay. So thank you, Roger. So you say about filling shoes, they're only size 6. They're not that large, and you will do it admirably. But the one piece of advice that I will give, and I think I've mentioned it before, is that you have a fantastic executive board. Okay, and today 4 new members have been voted on there. This is probably one of the best boards that and it's no disrespect to previous members, but the whole makeup of the board that I've seen today just stands us in such good stead for going forwards. As I say, I think this is our time. Okay, I think 2020 has been quite, a devastating year for lots of reasons, but out of the ashes, we will come and stronger. We are committed. We are looking after our staff. We are going to professionalize it. We are going to, I love the expression from Bonnie, we are going to strut our stuff. Not something we do that well, unless it's an 80s disco, and that's another thing we shouldn't talk about. But we need to do that. We need to be positive, and we need to say about the stories of what we do well. We also need to say, when we don't do that well, okay, because we are human, what we've learned from that and what we take from that, because that makes us better people going forwards. So, to everyone that's attended today, my absolute thanks. To the executive board, my double thanks. And if I can help anyone with anything at any time, people have my details. Just contact me, because I love to chat. That's it from me. Thank you.
So again, just to reinforce that, I want to thank all NARS execs for their work during the year. But I must say a special thank you to Charlotte Park, who some of you will know, especially from the Southwest region. I will be the first one to admit that I am not the most IT literate person in the world, but whenever I say that, or that is pointed out to me, I always turn around and say, yes, but I've got a Charlotte. Because when you look at the backgrounds behind Jane and I, and others that you've seen today, when you look at all the graphics, the branding, the slides, together with basically making all this work today, that's been done by Charlotte Park. So a huge thank you to Charlotte, because this conference would certainly not have been what it has been without her help. I'd also like to say thank you to all security events, Graham and Mike, the sponsors, Axis and Critical Arc, and speakers for giving their time to make, I think, a very fantastic conference a reality. And lastly, thanks to all of you, the NARS members, for your attendance and continued support. Just to let you know, as we said at the beginning, this conference has been downloaded or uploaded, whatever the saying is, by both the morning session and the afternoon session, and this will be uploaded to YouTube in the coming days. So for anyone who was not available to attend today, or for anyone who had such a fantastic time who wants to relive today, you will be able to do so on YouTube. So is there anything from anyone else that they'd like to say before we sign off?
I think that's a wrap, Roger.
In that case, thank you to everyone, and I declare the conference closed. Thank you very much.
Well done, everyone.